Okay, perfect. So I will send the question in the chat. 1, 2, 3, go.
Hey, hi there. My name's Sarah, and it's a pleasure to be here today. So I'll be talking to you about this question where a 14-year-old patient is here asking for birth control pills, and they would prefer if we don't tell her parents. So in this question, I think it's important to consider a few of the ethical principles, such as autonomy, which is the patient's right to make decisions about their healthcare, beneficence, which is the importance of doing good for our patients, and non-maleficence, which is the importance of not causing harm for our patients. So in approaching this situation, I think the first thing that's really important here is to just talk with our patient. I want to better understand why exactly she'd like to have birth control pills. So without making any judgments here, there's a lot of reasons someone could be requesting birth control pills. Just a few examples could include the fact that she's maybe having really painful periods and she doesn't want to experience that pain anymore and is looking for a way to stop having those painful menstrual periods. She might also be having really severe acne and read that maybe birth control pills could help with that acne. And she could also be having, she also could want to prevent any unwanted pregnancies. And so she's here requesting a birth control pill. So these are just a couple reasons why someone might request a birth control pill. But nonetheless, it's really important that I sit with my patient and I gather a full history so I can understand why they're requesting this. So once I've gathered this history and I've spoken with my patient and I've asked them why they're requesting these pills, then I can better understand how I can help them meet their treatment goals. So say, for instance, it's because they're having very painful periods. There's a lot of other options available that maybe the patient hasn't tried yet or that we could discuss together. Same thing for if they were having really severe acne. There's a lot of different treatment options available. And then finally, if the person was experiencing or was wanting to prevent an unwanted pregnancy, birth control pills would be an effective treatment. And that could be something that I discuss with the patient and make sure that they understand all of the implications of using birth control. So, for example, in this case, if they do want to use it to prevent pregnancy, I would also want to explain to the patient that using a birth control pill won't prevent the spread of sexually transmitted infections. To prevent that, they would also need to use some kind of contraception barrier, some kind of barrier contraception like a condom, in addition to using the birth control pill. So firstly, I want to respect my patient's autonomy, which is their ability to make healthcare decisions about their own healthcare. And to respect autonomy, we first need to make sure that our patients have capacity to actually make these autonomous decisions. So a 14-year-old patient although they're still like young and they're a minor, they still can have that capacity to make decisions about their healthcare without involving their parents. So that would be up to the physician's discretion to make through having a conversation with the patient and understanding their level of kind of their level of understanding of their health. And so if I was able to determine that this patient does have capacity to make her own healthcare decisions, then I have to respect her autonomy and make sure that I'm fulfilling her treatment goals. In addition, I would want to respect her beneficence, or I would want to maintain beneficence here, which is making sure I'm doing right by my patients. For this patient here, again, I would want to better understand why she'd like to use the birth control pills. But no matter what I'm doing here, I want to make sure that I'm doing good for her. So if that means treating the painful menstrual periods, if that means treating acne or preventing unwanted pregnancies, I'd want to be making sure that I'm doing good for my patient. And then lastly, I need to consider the principle of non-maleficence, which is again wanting to avoid any kind of harm. So I would want to think about the implications of not prescribing this birth control pill to my patient and what kind of consequences that could result in. And so that's really, again, dependent on the reason that the patient would want to use the birth control pill. But it's also important to engage in a conversation with this patient and, again, understand what her goals of treatment are and that she has the ability to make those decisions. And then lastly here, the patient is asking me not to tell her parents, sorry. And so that's important because of patient confidentiality. In medicine, patients have the right to maintain all of their healthcare information and not share that with people outside of their healthcare circle. So again, once I've determined that this patient has capacity, she's able to make her own healthcare decisions, and she has the autonomy to do so, I would respect her wishes of not telling her parents about this. So it's really important here to note that just because she's a minor doesn't mean that I have to tell her parents everything that goes on during this appointment. And that's really important in building trust with my patients. I would want this patient to be fully honest with me about her reasons for using the birth control pill and feel comfortable discussing her healthcare with me. And so to create that environment of trust and this kind of physician-patient relationship, I want to maintain her confidentiality so that she knows everything she says here will not be shared with people outside of her healthcare circle. So overall, to answer this question, I think it's important to note that first, we need to determine that the patient has capacity to make healthcare decisions and then respect her autonomy if she does have that capacity. We'd want to discuss the different reasons she might want birth control and make sure that whatever her reason is, we're meeting her healthcare goals. And lastly, because the patient is asking us not to tell her parents, if we've determined that she's, of capacity and she's able to make those decisions, we would respect her wishes and not tell her parents in this situation. And I think one thing to note in this situation again is I want to rule out any kind of exploitative relationships. So again, we don't know why the patient is asking for birth control, but on the off chance that maybe she's having sexual relationships with someone who's very much older than her, someone in a position of power, I want to make sure I better understand what her relationship is like and make sure she's not being exploited in any way, because in that case, I would have a obligation to report those kinds of relationships to make sure my patient is safe. So again, that's in a very offhanded chance, but nonetheless, it's something I would want to explore during this appointment. So thank you for listening, and I'd be happy to answer any follow-up questions.
Thank you, Sarah, for your answer. So, what would you do if you feel your patient does not have the capacity to understand the consequences of the decision they are making, and you feel like they don't understand the situation they are in, they don't understand the reason or how those medication works? What would you do if that was the situation?
Then I'd definitely be a little bit more careful about prescribing the medications. So again, then I would want to further understand why is she asking for the birth control pill. If she doesn't fully understand the implications of being on the pill and all the the adverse effects of being on the treatment pill, I would first want to understand what her goals of care are, because maybe then we could use a different kind of treatment modality that still meets her treatment goals, but is something that she's able to understand and she can still consent to.
I will send the second question in 3, 2, 1, now.
Hey, hi, my name's Sarah, and I'll be talking to you today about this situation about a 12-year-old boy diagnosed with a terminal illness and whose parents have requested that I don't tell him the bad news despite him asking me about the prognosis. So first, I think it's important to consider a few ethical principles here. So firstly, there's the idea of autonomy, which allows the patient to make their own decisions regarding their healthcare. There's also the importance of beneficence in this situation, which is about ensuring that we're doing good for our patients. And lastly, we want to talk about non-maleficence, which is the idea of not causing harm towards our patients. So this is a little bit of a complicated scenario, and I think the most important thing here would be to gather some more information. So from what I understand, there's a young boy, 12 years old, who's been diagnosed with a terminal illness. So first, I would want to make sure that I have a complete understanding of his healthcare history. I'd want to understand what exactly his diagnosis is. So here it says malignancy, but I'd want to make sure that I know exactly what diagnosis he's been given. I'd want to make sure I have the most up-to-date labs to make sure I know what his clinical picture looks like. I'd also want to make sure that I'm up to date regarding all the possible treatment modalities, what the adverse events of those treatments could be, and what the possible prognosis depending on the treatment that we choose. So before I speak to the patient, I want to make sure that I'm well educated regarding his clinical picture and that I'm able to answer any kind of questions that can come up during these discussions. Next, I think it's important to talk about the autonomy here. So despite the fact that our patient is a 12-year-old boy, he's still, although he's a minor, he still has the ability to understand what's going on regarding his healthcare. So I'd want to talk with the patient for a little bit and understand if he has the capacity to understand what a terminal illness is like, and if he really understands the downstream effects of, again, what it means to have a terminal illness. So in speaking with the patient and just getting to better understand his understanding of his healthcare, I'll be able to determine if he has capacity to understand his treatment and the prognosis he's been given. So in terms of beneficence, it's very important to tell patients honestly what's going on. That allows them to better understand their healthcare situation, to make decisions regarding what treatments are right for them, and also make decisions regarding what treatments they're not willing to accept. So in discussing with this patient, I'd want to make sure that I have all the information that I can describe to him in a way that makes sense, and also that is honest and lets him know all his different options available. Although the parents have requested that I don't tell the patient the information, I think withholding any kind of information from patients really disturbs patient-physician relationship. It undermines any kind of trust that I develop with my patients because they no longer trust me when I'm giving them any type of information, especially if I'm withholding something as important as a terminal illness. So first, I'd also want to talk with the parents before I actually tell the patient about his terminal illness. I'd want to see with the parents why exactly they'd want me not to tell their child about it. So maybe they're afraid of how he'll react. Maybe they're very stressed out about the diagnosis and they don't want to stress him out. Maybe the child has a learning disability or some kind of cognitive disability that makes it difficult for them to understand what their healthcare situation is like. So first, I'd want to talk with the parents, understand what their perspective is, and try and ease their concerns about talking to their child about this serious diagnosis. Once I've done that and I have a better understanding of what's going on, if I can determine that the patient has capacity and he is able to understand these kinds of important healthcare decisions, I would want to explain to the parents how it's really important for the child to know what his diagnosis is, and it can actually provide with him some kind of control over his life, that he's able to understand what diagnosis he's been given and what kind of decisions he can make regarding that diagnosis. So I think that plays into the role of beneficence in this situation because I want to do good by my patients by giving them all the information necessary to make a fully informed decision. Next, I want to talk about non-maleficence here. I do realize that telling a patient that they have a terminal diagnosis is extremely stressful for the patient and basically life-altering news. So I understand that the parents might not want me to tell their child this news because of how distressing it could be for him. However, I need to balance that with the fact that, again, I'm undermining my trust with the patient and I'm taking away his ability to make informed decisions regarding his healthcare if I don't tell him about his diagnosis. So in this case, I think the idea of autonomy and beneficence overrule the idea of withholding this information from the child. So I would, if I can determine that he has capacity and he's able to understand what a terminal illness really means, I would want to tell him this news. This would, again, allow him to make kind of plans for the future if there's certain things that he wants to do during the time that he has left, and also tell him about the different treatment options that are available so that he can make a choice that suits his needs. So overall, in answering this question, I think it's very important to gather some information, talk with the parents, understand what their concerns are, and then ultimately make sure that the child is capable of understanding what a terminal illness is and what that means for him. And in the end, I think making sure that the patient has capacity, I would tell him about his diagnosis to allow him the ability to make treatment choices and plan out his future from here on out. So thank you for listening, and I'd be happy to answer any follow-up questions.
Thanks for your answer. How would you, as a doctor, manage and handle stressful situations like that, especially if they are repetitive within your work schedule?
Yeah, so I think as a physician, you're dealing with very stressful life events on a daily basis, and you need to make sure that you're taking care of yourself to avoid burnout and to avoid just being overwhelmed by your work. I think part of that involves talking with your colleagues and your healthcare team if you feel overwhelmed, if you're having to go through an extremely difficult situation like this one here, where you're telling a pediatric patient that they have a terminal illness. It's important to check in with yourself, talk with your colleagues, and seek help whenever you need it to make sure that you're taking care of your own mental health and that you're still able to provide compassionate care with your patients. Because not checking in with your emotions and just trying to push everything down, long term, that doesn't really work. And eventually you will feel burned out and you will find it difficult to find compassion for your patients anymore. So I think talking with your colleagues, working through these difficult emotions are really important to avoid that kind of burnout.
Three more questions to go. I'll send the third question in Three, two, one, go.
Hi there, my name's Sarah, and I'll be talking to you about the situation today about an 18-year-old man who has suspected bacterial meningitis, but he's refusing therapy and wants to return to his college dorms. So in discussing the situation, I think there's a few ethical principles at play here. Firstly, I want to discuss autonomy, which is a patient's right to make their own decisions regarding their healthcare. I also think beneficence is very important here, which is the importance of doing good for our patients. And then lastly, about non-maleficence, which is wanting to avoid all harm, and also justice, which is about making sure that healthcare resources are equitably divided within society. So firstly, in approaching this situation, I think the most important part here is to just talk with my patient and better understand what his perspective is. So what I can see from the question here is that he's an 18-year-old man and he's been diagnosed with a suspected bacterial meningitis. However, he's refusing therapy. So I'd want to talk with my patient and better understand why he's refusing therapy. There could be a lot of reasons here that I don't fully understand. So I'd want to talk with him. Maybe he has an allergy to an antibiotic, and now he thinks that he's not able to receive therapy because he has this allergy. He might also have some distrust of the medical system and doesn't want to receive any treatment from a hospital. He might also not understand what bacterial meningitis is and thus thinks that he doesn't need any treatment to begin with. So there's a lot of reasons here that a patient could refuse therapy. And I think it's really important that we talk with our patients and we explain to them in a way that makes sense their diagnosis as well as their treatment options. So once I've spoken with my patient and I have a better understanding of why he's refusing therapy, I'd want to see if there's a way that we can match his treatment goals. So this brings in the idea of autonomy here, where we need to respect our patient's wishes regarding their treatment. So first, I want to make sure this patient has capacity to make these healthcare decisions. So that means that he's able to understand the diagnosis he's been given. He also understands the different treatment options, and he knows what the possible benefits of those treatment options are and what the possible adverse events could be. So once I've spoken with my patient about this, and I understand that he understands all of that information, then I know that he has capacity, and I have to respect his autonomy. If he continues to refuse therapy after all of that information has been shared with him, then I still have to respect his wishes and not treat him in that case. However, I think having a conversation with him, making sure I'm addressing any of the concerns he has, I think together we would be able to find a treatment plan that really suits his needs. So that's really about managing the patient's autonomy and making sure I'm respecting his treatment wishes. In addition, the ethical principle of beneficence is really important here. Bacterial meningitis is a very serious diagnosis, and if it goes untreated, the patient could die. So it's important that I want to do good by my patients and making sure that I'm able to prevent any of those adverse outcomes. So again, that really comes down to making sure that we pick a treatment plan that is suitable for my patient and that my patient truly consents to. I also, non-maleficence is very similar in this scenario because, again, I want to avoid any kind of adverse events. And because this is such a serious diagnosis, I want to make sure that my patient understands the possible adverse events and that we're able to meet his treatment goals. And then lastly here, I see that the patient wants to return to his college dorm. And that's a little bit worrying for me in terms of the general population. Bacterial meningitis is possibly is something that can spread from person to person. And if he's going back to his dorms, he might be around a densely packed area with a lot of people. So it could be possible that this bacteria spreads among the dorms. So it's important here to make sure that we're fulfilling the ethical principle of justice, making sure that everyone has equitable access to healthcare. I'd be a little bit worried that if I were to let him return to his dorms without any treatment while he's still very while he still has the infection, there's a risk that he could spread it to other people. So in this case, again, I'd want to have a conversation with him, understand why he wants to go back to his dormitory, and see if we can figure out a treatment plan that doesn't put the rest of society at risk in terms of spreading that bacterial infection. So for instance, maybe because he's in college, he might be worried about his exams or his classes because being in the hospital will mean he'll have to miss out on a lot of like exams or classes or things like that. So again, I'd want to talk with him, better understand what his perspective is, and if there's a way that we can make sure that he's not missing out on classes, or if there's a way we can get him his class material while he's in the hospital so he doesn't feel so behind. So overall, my role as a physician in this scenario is to better understand my patient's perspective, making sure that they understand their diagnosis, the different treatment plans, and that I'm respecting their autonomy when they have capacity to make those decisions. So overall, we've talked about the ethical concerns of autonomy, beneficence, non-maleficence, and justice in this situation, and making sure that we're doing right by our patients and respecting their autonomy based on whatever treatment plans they have in mind. So thank you for listening, and I'd be happy to answer any follow-up questions.
Thank you, Sarah, for your answer. Where do you think we should draw the line where we limit the autonomy of a patient, or we take it away for the greater good of the society, similar to what happened with the vaccine during COVID-19?
Yeah, so that's a really good question, and I think it's a very fuzzy line to be able to draw it clearly out in the sand. But I think one way of thinking about it is we should try to not limit people's autonomy as much as we can until it starts to interfere with other people's autonomy. So like the vaccine, it wasn't mandated that people had to absolutely get the COVID-19 vaccine, but there was a lot of barriers in place for people who didn't get the vaccine so that we could promote vaccine uptake. So although we can't force a treatment onto someone if they have capacity to refuse treatment, we can put barriers in place to try and protect the rest of society. So for instance, when people had COVID, they were asked to stay at home for a certain number of days to make sure that they didn't spread it to other people. So they can refuse treatment or they can refuse to take the vaccine, but we can put in societal barriers to try and protect the rest of society. So I think we draw the line when someone's autonomous decisions are now interfering with other people's autonomous decisions.
Makes sense. Thank you very much. Next question in three, two, one.
Hi there, my name's Sarah, and I'll be talking to you today about the situation where I'm a physiotherapist working with a 16-year-old patient who has eventually told me that they're being abused by their parents, but begs me not to tell anyone. So this is a very serious situation with a lot of ethical principles at play. Namely, I'll be talking about autonomy, which is the patient's right to make decisions regarding their healthcare, the importance of beneficence, which is wanting to do good by our patients, as well as non-maleficence of wanting to avoid all harm for our patients. So firstly, I think the first thing I would want to do in this situation is make sure that my patient doesn't have any life-threatening injuries. If they are currently, say, bleeding out, or they've lost consciousness, or there's something very serious going on, the first thing I want to do is make sure my patient is receiving quick care so that they don't have any adverse events like death. So once I've ruled out any life-threatening injuries, and if I do see any life-threatening injuries, I would alert a physician right away to make sure that they're receiving care. Once I've ruled that out, I'd want to talk with my patient a little bit more to better understand what's going on here. So based on the stem, I understand that the patient has some severe burns as well as some unexplained bruising. And the patient has told me that they're being abused by their parents. So I'd want to better understand what the home life is like. Is there any weapons at home? Is there any drugs or alcohol involved during these encounters? Is there any other children at home that could be also being abused? I just want to talk with my patient and better understand what's going on. I'd also want to make sure that she feels safe and comfortable telling me this information. I would first tell her how courageous it was of them to tell me what's going on here and feel comfortable enough to talk with me about it, because this is obviously a very personal issue, and I'm glad that they felt comfortable to bring it up with me. So once I've talked with them a little bit about what's going on and what other dangers there could be at home, I would um, I would want to talk to the patient about how this shouldn't be happening to them, and this is a very difficult situation for them to be in. So first, I'll talk about autonomy here, which is the patient's right to make choices regarding their healthcare decisions. So because the patient is 16 years old and they are being abused, they claim to be being abused by their parents, which are people in a position of power, I do have an obligation to report this. Even though the patient is telling me that they don't want anyone to know about it, I do again have an obligation to report it because they're a minor, and I want to make sure that they have a safe place at home to live. So I would tell my patient that I do have an obligation to report this because I want to be totally upfront with them and not have to lie about anything that's going on. However, I want to make sure that my patient is still safe when they go home. So that means making up a possible plan for the patient if she doesn't feel comfortable going home after our appointment, seeing if I can contact any shelters or any family members that she trusts that could take her to a different location where they would be safe. So next is the idea of beneficence, which is again wanting to do right by my patients. I can see that the patient has told me they're being abused at home, and so I want to do right by not sending them back into a place where they could possibly be injured. Um, this also means making sure that anyone else at home is also not being abused if there's any other children at home or anyone else that could be involved, and making sure that this is a safe environment for my patient. And then lastly, the idea of non-maleficence here is very important. The patient seems to be really worried about me telling anyone about this abuse. So I am worried that maybe the abusers have told the patient that if they tell anyone what's going on, they're going to, do XYZ, do something even more severe. So I'd want to try and reassure my patients that we're going to find somewhere safe for them to go, somewhere that they won't be abused, and also explain that this is not normal and that I'm glad they told someone what's going on so that we can better handle the situation. So overall, first I would want to check that my patient is not in doesn't have a life-threatening injury. And then I would explain to them that I have an obligation to report what's going on and to make sure that they have a safe place to go at the end of our appointment, assuming that maybe they don't feel comfortable going home afterwards. It's also really important that I maintain a relationship, or I explain to the patient that I'm glad they brought this up and that we're going to make sure that we follow up with them, that this isn't the last time that they're going to see me, to make sure that they feel comfortable talking with me and that we can arrange a plan long term for them to make sure that they're safe. So thank you for listening to my answer, and I'd be happy to answer any follow-up questions.
Thanks, Sarah, for your answer. Where would you say um, your scope of practice as a physician ends, and you would handle the ball to someone else who would take this case, because this is definitely something that would require a lot of attention, a lot of time, and a lot of skills. So, what would you say to that?
I think it's important to realize that as physicians, we're just one member of a very important healthcare team. And it's important to realize where I'm no longer an expert anymore. So in this situation, my patient has told me that they're being abused at home, and I know that it's within my scope of practice to report this kind of abuse because they are a minor. However, I'm not an expert on how to deal with child abuse and how to make sure that this child has a long-term plan to make sure that they're safe at home. And that's where I would refer to my social work colleagues, as well as any other healthcare professionals that are involved in managing the care of children. So it's really important that all healthcare professionals know what their scope of practice is and understand when they're no longer experts on the area. But it's important to realize that we all have a legal and medical legal obligation to report any kind of child abuse. And that has to be widely known by the healthcare professionals to make sure that we're really catching all of these cases and we're making sure that children are being taken care of. So it is my duty here to report this and to make sure that this patient um, has a safe place to go at the end of my appointment. But it's also important that I realize I'm not an expert in this field and that I need to reach out to my colleagues like social work to make sure that we're really handling this patient in the best way possible.
Amazing job so far. And to our last question, In 3, 2, 1, 0.
Hey, hi there. My name's Sarah, and I'll be talking to you today about the situation where I'm a specialist with a patient who just recently was diagnosed with terminal cancer, and how there's unfortunately not a lot of treatment options available, except for a few experimental options that maybe don't have validated efficacy. So in discussing the situation, there's a few ethical principles at play here. Firstly, I'd want to talk about the autonomy of the patient, which is their right to make healthcare decisions regarding their treatment plans. I think it's also important to talk about beneficence here, which is the idea that we want to do good by our patients and promote well-being. On the other hand, there's also the idea of non-maleficence, which is where we want to avoid causing any harm to our patients. And lastly, I think the ethical principle of justice is really important here, which is about the equitable division of healthcare resources to make sure that everyone has access to the healthcare that they need. So firstly, in approaching the situation, I'd want to gather a little bit more information about what's going on here. So I see that based on the lab results that I've received, this patient has been diagnosed with terminal cancer. So I want to, again, just make sure I review the labs correctly, make sure that I actually reach the correct diagnosis. I haven't made any logical fallacies, or I haven't made any logical mistakes in determining the diagnosis. I haven't misinterpreted any of the labs, and that I really did a thorough job diagnosing this patient. So once I've confirmed the diagnosis and I'm very much certain in, again, the terminal cancer that this patient is supposed to have, then I'd want to make sure that I've truly looked at all the possible treatment options. It seems here that there's only a few experimental procedures that are under study, and they don't have validated efficacy at this point. So again, I want to make sure that I'm gathering all the possible information. I haven't missed any new experimental procedures or treatment plans that actually have shown efficacy, and that I really try to exhaust every possible treatment option available for my patient. So once I've gathered all of this information, I would want to speak to my patient face to face in a private setting where they feel comfortable talking about things like this. So first, I'd want to better understand, does my patient know that she even has this diagnosis, or is this kind of coming out of nowhere for her? So I'd want to prepare her for receiving some very bad news and make sure that she's ready to hear what I'm about to tell her. So here comes the idea of autonomy, which is the patient's ability to make healthcare decisions regarding their treatment plans. So I'd explain to my patient the diagnosis in terms that make sense for her, as well as the different treatment options that I've found through the research. assuming my patient has capacity, which is basically she's able to understand her diagnosis, she's able to understand the pros and cons of all the treatment options, it's my job to respect her autonomy. I would explain to her what's going on and then let her make the decision as to what treatment option she'd like to pursue, or any treatment option at all. In this case, I would explain to her that, again, there aren't many treatment options available, and none of them so far have shown any efficacy, so they don't seem to really be working. But that doesn't mean that there are no options. There's always the option of like palliative treatment, where we're treating her symptoms and trying to make sure that for the rest of the time that she has alive, that she's going to be comfortable and can spend that time doing things that are meaningful for her. So I understand that she has 2 young boys, and that's probably weighing on her mind as to what's going to happen to her children once she passes. So I'd want to talk with her, make sure that I've addressed all of her concerns. So if she is worried about her children, we can look into ways that we can ensure that they have like if there's anyone else who can look after them, if she has maybe a significant other, or if any family members are able to take care of her children when she passes. I'd also want to make sure that she feels comfortable talking with her children about her diagnosis and explaining to them what's going on. If she needs any help with that, I would be happy to be there for that conversation if that's something she would want. So overall, I would explain to her the treatment options and see if she's interested in any of them. So next I'm going to talk about the idea of beneficence, which is doing right by my patients and making sure we're promoting well-being. So again, unfortunately, it seems like there's no real treatment options here that show evidence for efficacy in treating her diagnosis. So I would be very weary of recommending any kind of treatment options that don't show benefit for my patient, because I want to make sure I'm doing good by them. That doesn't mean that I can't offer her those treatment options. It's still my responsibility to make sure that she has a full understanding of all the options available to her. So I would tell her that there are alternative treatment methods that are under research, but I would again explain that there's no evidence that they're working right now. In terms of non-maleficence, which is not wanting to cause any harm to my patient, I would make sure that all the treatments that I'm explaining to her, that I also would describe any possible adverse events. Especially in a lot of alternative medicine, there could be possible adverse effects that aren't well known by patients. So I'd want to make sure that I've done all my research and I'm able to explain to her any negative effects that could come from trying these treatment methods. And then lastly, I think it's important to talk about justice here. It's very difficult to treat terminal illnesses. That's kind of why they're terminal. And it's important that there is equitable division of healthcare resources to make sure that all patients have access to healthcare. So a lot of alternative medicine treatments, or treatments that are still under investigation or being researched on, they can be very expensive because they're not covered by government formularies, because they don't have any evidence at this point. So the patient might have to pay out of pocket to have access to any of these medications that, again, haven't been verified to work yet. So when I'm explaining the treatment options to my patient, I would want to explain that as well, to make sure she understands that there might be a cost out of pocket that maybe she wasn't able to factor in beforehand. So overall, even if there is an alternative treatment method that exists that doesn't have any evidence, I do think I need to explain that to my patient and make sure that she's aware of that treatment option. But I wouldn't want to promote it onto my patient or kind of coerce her into picking that treatment option. I would want to give a very neutral information, make sure that she understands that it is an option, but there again is no evidence to say that it works. So overall, today I spoke about the importance of autonomy, of beneficence, non-maleficence, and justice, and wanting to do right by my patients by letting them make choices that are truly informed. So thank you for listening, and I'd be happy to answer any follow-up questions.
Thank you. How would you say the emotional aspect of the situation would impact the decision making of the patient and an impact the way you approach the presenting the options?
Yeah, I think this is a very emotionally charged situation, especially if the patient has never heard this news before. So I would want to factor that into our discussion. She might not even be prepared to listen to any kind of like medical treatments or discussion as to what this means long term after she's received the news that she has a terminal illness. So if that is the case, I would see if I can book her in for another appointment when she is ready to hear that information. So I would take things at the pace that my patient feels comfortable at. And if she's not ready to hear that information, I would let her kind of process her emotions and see if I can refer her to anyone that could help with that. Yeah, I'm over time.
Okay, perfect. You actually did amazing. Great job. You are still very sharp. Um, and do you have any advice or any suggestions you would have for people who do the MMI?
Sure. Yeah, there's a lot of advice out there. Um,
Mhm.
so all of these questions were like ethics questions, but sometimes they ask
Yeah.
things like, tell me about a time you did XYZ. So I always tell people
Mhm.
to learn the CADMED roles, have examples of things that relate to every CADMED role so that they don't have to, they're not spending the 2 minutes trying to think of an example. They already have the example ready and they can speak about it in a way that is answering the patient's the question stem. For ethical questions, I always start, you introduce yourself, then you give a short summary of the question. That way, if you misunderstood the question, the reviewer or like the person will tell you, oh, hey, I think you misunderstood, or like, hey, this is actually not the question you're supposed to answer. And then I give like a summary answer. I talk about the ethical principles I'm going to talk about. I define them so that the person knows that I know what I'm talking about. Then you give your answer. I aim for like 6 to 7 minutes so that I have time if there is a follow-up question. But you shouldn't like repeat yourself over and over again to the point that you're saying the same thing twice just to reach that time limit. And you also shouldn't like rush yourself if you feel like you're not going to hit that time limit. So it's kind of like an art
Mhm.
there. And yeah, I give a little summary at the end in case they weren't listening, and then I wait for
Yeah.
follow-up questions.
No, absolutely. Assessment is important, I would say.
Mhm.
Yeah. Is there anything else or
No, that's my approach to all the questions.
no? Yeah, perfect. Well, thank you very, very much. I will just end the recording here.